40-year-old male in a road traffic accident, MRI of the brain. T2 weighted image is showing mucosal thickening in bilateral maxillary sinus, mixed signal intensity fluid in the bilateral posterior choana and the nasopharynx. The nasogastric tube is seen in situ. I can see fluid in both the mastoid air cells bilaterally. There is a fluid level on the right side. Mucosal thickening in the sphenoid sinus with altered signal fluid within. There is a parenchymal hemorrhage in the left temporal lobe. There is an extradural biconvex right temporal large hemorrhage. Anterior bifrontal subdural effusion is present with a thin rim of bleed, subdural bleed along the left inferior frontal convexity. There's a subtle blood CSF level in the posterior horn of left occipital lobe. The increased pressure in the bilateral middle cranial fossa is resulting in descending transtentorial herniation, bilateral uncal herniation. There is a foci of bleed in the left cerebellar hemisphere. There is a right parietal scalp hematoma. T1 weighted images showing the same findings. The bleed is the susceptibility weighted images. MIP projection definitely shows there are again multiple foci of parenchymal bleed in bibasifrontal cortex, in bilateral cerebellar hemispheres, in addition to the previously mentioned foci of bleed. A case of polytrauma demonstrating subdural, extradural, and intraparenchymal bleed with a small ventricular extension.